So the flu season is here. We're actually seeing lots of cases in the emergency department and around the nation. Uh, those are some of the things we've been seeing. People are presenting with fever, body aches, chills. It's just that time of the year, so please protect yourself. People actually ask about how effective is the flu vaccine. It is. I mean, it works. There are some patients who may have some complications that are at certain risks. You just have to really discuss this with your provider to kind of figure out what's best for you. About 60 to 50% effectiveness is significant if it keeps you out of the hospital from complications of pneumonia, meningitis, death, other things that go along with this, even days lost from work, from family, or getting a loved one or an elderly um, or family member sick. So those are some of the things one has to consider when having these discussions and making a decision of what we call a risk benefit. Flu vaccine is for everybody at most. There are some people who have some contraindications. You can discuss that with your doctor, reasons why you shouldn't. But for the most part, it's safe and effective. And you should consider getting the flu vaccine. I'm getting the flu vaccine. I want to protect myself and my family members and loved ones. And I also want to be able to be at work and to help people and to make sure that I'm not part of the problem, meaning a burden on the emergency department or healthcare system by being sick and trying to protect myself. So who's at risk? Well, definitely your kids under 5, I would say, fall into the high risk category, especially the younger kids. They're approved for certain age groups. You can check on the cdc.gov website, but also for elderly who are 65 and over, uh, those who have health risk, health complications, diabetes, neurologic symptoms, other things that basically put you at risk, underlying medical conditions, if you're immunocompromised, those who are pregnant. These all fall into those risk categories. We all should be familiar with this. We've had exercises through real life pandemics such as COVID. We've had influenza outbreaks every year. So this is nothing new to the public, but it's something we should keep our minds on and be aware of. It's just one of those things we just have to do to protect one another and get through this season so we can enjoy hopefully another summer, spring, but we got to go through this part of the weather. You're definitely seeing lots of cases with influenza, and patients are coming in sick. Classic example of one of the patients I took care of, a 21-year-old who had body aches, fever, chills, high fevers to 104, 105, and had a sore throat. Well, there's a big differential. There are other things you have to consider. That's what I mean. And is this flu? Is this COVID? Is this just your regular common cold? Another one of the thousands of other viruses that it could be? Is this strep throat? Is it mono? There are lots of things to think about. Or is there something else that's going on? So you have to ask the questions, and it's all based on the history. Suffice it to say, I wouldn't be talking about it if it wasn't a flu case, so you probably figured that out. It is a flu case, and the patient had flu. We checked for flu, COVID, RSV, and other things. None of those came back positive except for influenza. What do we have to do? Well, hydration, fluids, pain management, Tylenol, ibuprofen, whichever works best for the patient, and just making sure that they're drinking fluids and staying healthy and monitoring their vital signs. And they get discharged home in this case because he wasn't high risk and he's pretty much healthy. He was discharged to home under the supervision of his primary care physician. But for other people, it might not be that simple. For those extreme of ages that I mentioned and those at high risk or immunocompromised, they might end up in the hospital. Some might end up with a tube down their throat because they have a pneumonia. Some might have other complications, such as a form of meningitis or some type of neurologic symptoms. Guillain-Barré, which is an autoimmune disease where your body starts to attack itself as a trigger from this virus. So These are some of the things you have to consider. So it's a risk benefit ratio. You have to really consider that. You know about influenza now, and you've known about it for a while, but it's important. So if there's anything I need to stress, what's your take home message? What do I need to do now, doc? You ask. Okay. So you need to remember how we do strict hand washing. Okay. You need to remember to wear your mask to protect yourself and others. You need to social distance and try to limit your contact with large environments where people congregate and things like that. Just reduce your risk. So those are some of the things we've learned this during COVID, and we've known this for a while. So those are the things to help prevent the transmission of the virus and you getting sick. But other things you can do, natural kind of things, in addition to the behavioral things that you should do, would be considering making sure you're drinking plenty of fluids, exercising appropriately, and maybe you're taking some vitamin C, orange juice, or other sources of vitamin C. There are other antioxidants, several on the markets. Vitamin D is also a good one. Also, just make sure you talk with your doctor to make sure these aren't things that you can't take because everybody has their own individual body habitus, and you might have your own medical conditions or things where your doctor has said maybe you shouldn't take this or you can take that. But we have to emphasize prevention. I think it's a key piece to all of this and natural things that you can do. But of course, when it becomes um, on the other side where you can't prevent these things or you're already starting to develop symptoms, you can support your immune system with the vitamin C's, the uh, vitamin D's, plenty of fluids, hydration, rest, all those things, and of course, protecting yourself. But the number one preventative thing you also can do is get vaccinated so that your body has a way to respond better. It will shorten the day or duration if you even develop flu. And it also can significantly prevent you from actually getting the flu, along with the other things you do. It's not a shield, and it's not a force field. It's just, to help protect you as best as it can. Or what I'm trying to say is it's not a force field, it's a shield to protect you.